We all want to be healthy, but good health doesn't come cheap. This is where health economics comes in. It's about making sure we use our healthcare resources wisely. We need to balance cost, quality, and access for everyone. It's a complex issue, but it affects us all. Health economics helps us understand the choices we make. Every decision has an impact. From government policies to individual treatments, there are always trade-offs. By studying these choices, we can find ways to improve our healthcare system. We can work towards a future where everyone has a chance to live a long and healthy life. In the 1960s, America took a huge step forward. It created Medicare and Medicaid. These programs were designed to help vulnerable populations access healthcare. Medicare provides coverage for seniors over 65. Medicaid assists low-income individuals and families. These programs were game changers. They provided a safety net for millions. Before Medicare and Medicaid, many Americans struggled to afford healthcare. The elderly and the poor often went without essential medical services. These programs helped to level the playing field. They made healthcare a right, not a privilege, for a significant portion of the population. In 1983, the healthcare landscape shifted again. The DRG system was introduced. DRG stands for Diagnosis-Related Group. This system changed how hospitals were reimbursed for their services. Instead of paying for each individual service, Medicare started paying a fixed amount based on the patient's diagnosis. This move aimed to control rising healthcare costs. By incentivizing hospitals to be more efficient, the DRG system hoped to reduce unnecessary procedures and shorten hospital stays. The system had a significant impact on hospital operations and healthcare spending. It also sparked debate about the potential trade-offs between cost control and quality of care. Over the years, healthcare costs in the U.S. have continued to rise. This trend has put a strain on individuals, families, and the overall economy. The reasons for these escalating costs are complex and multifaceted. They include factors like technological advancements, an aging population, and administrative complexities. Recognizing the urgency of this issue, the government passed the Inflation Reduction Act. This legislation includes provisions aimed at lowering healthcare costs. One key element allows Medicare to negotiate drug prices with pharmaceutical companies. This is a significant step towards making prescription drugs more affordable. The Act also caps out-of-pocket costs for Medicare beneficiaries, providing financial relief for seniors. Beyond the lab real-world evidence in healthcare, traditionally medical evidence relied heavily on clinical trials. While important, these trials don't always reflect the real world. Real-world evidence, or RWE, offers a broader perspective. It gathers data from everyday medical practice, including electronic health records, insurance claims, and patient-reported outcomes. RWE provides valuable insights into how treatments work in real-life settings. It helps us understand which interventions are most effective for diverse patient populations. This data-driven approach is transforming healthcare decision-making. It allows for more personalized and effective treatments. RUE is also instrumental in evaluating the long-term impact of healthcare policies. A matter of fairness, health equity in New York and Texas. Health equity is a fundamental principle of a just society. It means everyone has a fair and just opportunity to be healthy. Unfortunately, disparities in healthcare access and outcomes persist across the United States. States like New York and Texas are taking different approaches to address this challenge. New York has implemented initiatives to reduce racial and ethnic disparities in maternal health. These programs focus on providing culturally competent care and addressing social determinants of health. Texas, on the other hand, has faced criticism for its Medicaid policies. Critics argue that these policies limit access to care for low-income women and children, exacerbating health inequities. Bridging the gap. Initiatives for health equity. Across the nation, a collective effort is underway to bridge the health equity gap. Government agencies, healthcare providers, and advocacy groups are working together to create a more equitable healthcare system. These stakeholders are implementing various initiatives to address disparities. One focus is on expanding access to care in underserved communities. This includes establishing community health centers, increasing the diversity of the healthcare workforce, addressing language barriers. Another crucial aspect is addressing social determinants of health. These are the non-medical factors that influence health outcomes, such as poverty, housing instability, food insecurity. The value of health shifting from volume to value. The US healthcare system has long been criticized for its focus on volume over value. Traditionally, providers were reimbursed based on the quantity of services they provided, regardless of patient outcomes. This fee-for-service model has contributed to rising costs and, in some cases, unnecessary procedures. To address this issue, there's a growing movement towards value-based care. This model incentivizes providers to deliver high-quality care that improves patient outcomes while controlling costs. Under value-based care arrangements, providers are rewarded for keeping patients healthy and out of the hospital. This shift requires collaboration among payers, providers, and patients to achieve shared goals. The digital doctor technology's impact on healthcare. Technology is rapidly transforming the healthcare landscape. From telemedicine to artificial intelligence, innovations are revolutionizing how we deliver and access care. These advancements have the potential to improve patient outcomes, enhance efficiency, and make healthcare more accessible. Telemedicine, for instance, allows patients to consult with healthcare providers remotely, increasing access to care for those in rural or underserved areas. Artificial intelligence is being used to develop diagnostic tools, personalized treatment plans, and streamline administrative tasks. While these technologies hold immense promise, it's crucial to ensure equitable access and address potential ethical concerns. The future of care trends shaping US healthcare. The US healthcare system is constantly evolving. Several trends are shaping its future, presenting both challenges and opportunities. These trends include the rise of chronic diseases, the aging population, and the increasing demand for personalized medicine. As the population ages and the prevalence of chronic diseases rises, the healthcare system faces the challenge of managing complex and long-term care needs. This requires a shift towards preventive care, chronic disease management, and care coordination. Additionally, the demand for personalized medicine is growing. Patients and providers are increasingly seeking treatments tailored to individual genetic makeup, lifestyle, and preferences. A healthier tomorrow, challenges and opportunities. The evolution of health economics in the US has been marked by significant milestones and ongoing challenges. From the introduction of Medicare and Medicaid to the implementation of the DRG system and the recent Inflation Reduction Act, policymakers and healthcare leaders have grappled with the complex task of balancing cost, quality, and access. Looking ahead, the US healthcare system faces a number of challenges, including rising costs, health disparities, and an aging population. However, there are also significant opportunities to improve healthcare delivery, enhance quality, and promote health equity. By embracing innovation, fostering collaboration, and prioritizing patient-centered care, we can create a healthier tomorrow for all Americans.